The Smart Clinic helps me to stay healthy so I can be the best student I can be.
It's so helpful to have a clinic inside your school that you can access every day.
The staff at the Smart Clinic does feel like family.
They listen to me and take care of me and do everything for me.
SMART is a school health solution that's dedicated to academic achievement. It's a business model. SMART stands for School Health Model for Academics, Reaching All, Transforming Lives. SMART really lives at the intersection of health, education, and workforce.
The ultimate outcome is not just making sure that the student is healthy, it's about making sure that that health enables the student to complete their education.
It's a holistic approach and it's a collaborative approach.
So the SMART model fills that essential gap of bringing physical health and mental health inside our schools. And that is foundational to a child being able to learn, function, and then to reach their potential. And the beauty of the SMART model not only serves all youth inside the school environment, but all employees, all families within that school as well.
Before I went to the Smart Clinic, we took the PSAT and I got a really low score. Then I started going to the clinic and talking about how I'm stressed, and they helped me deal with it. When I took the actual test, I rose about 200 points.
Typically in Chicago, you have needs, but also all over the nation, you have similar needs where you have kids that just are not being served. In my particular community, our school's a 97% free and reduced lunch school. We knew that we had to attack wellness to make sure that our kids were able to be victorious and successful in all of their pursuits. We've been looking at the design of the school and blaming the people in the school for how the school's been performing, but we have not challenged the system that's around the school to make sure that our kids get what they need.
Clinics shouldn't live in this crevasse between health and education, and it became clear to me that our business was education.
CVS's commitment to the SMART model is really grounded in our purpose. We know for sure that healthcare is foundational to educational attainment, and we know for sure that breaking the cycle of poverty is related to educational attainment. So this has a ripple effect that goes far beyond just the confined walls of the school itself.
I had a lack of sleep. I felt that it was really impacting my day. So I went to the clinic. They gave me an article regarding problems that people have that impacts their sleep. I did see a great improvement in my schoolwork.
Over the history of our launching SMART Student Health and Wellness Centers, we've seen that it really on average takes just a couple of years to go from schools that were performing at subpar levels to being best in class.
This isn't just some program that you do for a year or two. This is a fundamental shift in thinking. This is embedding proactive physical and behavioral health care into the school as normative.
Within the first 2 years of the SMART model, we were able to take attendance from an average 80% attendance to 90%. And the graduation rate is 40%. We just got numbers back last week. We're at 70%. Those are just numbers you don't see in high schools, ever.
The dollars that are put into SMART Student Health and Wellness Centers are not expenses. They are truly investments.
To date, the data tells us that SMART works more quickly, more efficaciously, reaching more students for better outcomes, all at a lower cost. And I want that for every student that needs it in this country.
My daughter has asthma. If she's ever having shortness of breath, it really puts me at peace knowing that my daughter is in good hands with the Smart Clinic and they really truly know what they're doing.
My nurse practitioner, every time I see her, I want to stay there at the Smart Clinic. They treat me really nice. I love them so much. I want to keep going there every day and every day.
Active access means we have that captive audience and they know that we're down there for them, to care for them. Active care is teaching them, if you're not feeling well, don't wait till you're feeling worse. Come on in and be proactive and take care of yourself.
When they told me that everything was going to be all right and there was nothing for me to be scared about, and that they told me they were going to treat what I was feeling right away, it made me feel a lot better. I can feel safe in there, which is really great.
SMART is really made up of a coalition of individuals and entities that have taken a chance on something new. It's really everyone recognizing how this works and why it works and supporting it.
We're going to transform the system, and we're going to build sustainable community and school-wide supports. And I want to quote from my awesome dean, Dr. Halebowitz, and his vision is this, that the SMART model will become as normative as a school library, as a school cafeteria, a school playground. So leadership is the most important piece to sustainable change over time.
If you are in an organization that in any way can help shape or impact educational attainment of children, you need to get engaged in helping us replicate this model across the country.
Any administrator, any principal, any school will be lucky to have a model like this.
How many times do you have a chance to change everything?
Every school should have a smart clinic.
I love the Smart Clinic this much.
To learn more about SMART, please contact Ginn Group Consulting at smartstudenthealth.com.